Hello, welcome to Service Coordination Support's Autism Spectrum Disorder 2021-2022 Application Instructional Video. We hope this video will help you in better completing your application. ASD Funding is intended to help children under 18 years old with a diagnosis of autism spectrum disorder access respite services. This funding is strictly to purchase respite supports and cannot be used towards therapies, equipment, and other support needs. Respite support can include camps, overnight respite, in-home respite, supports by a special needs worker, and recreational activities. Families must submit a new application each year. All questions in the application reflect the child's needs and the family's situation at time of the application. This information is then reviewed and used to help allocate the available funding. The amount of funding allocated to applicants will be determined by the amount of funding available each year, as well as the number of applicants we receive. It is important to note that allocations are based on needs. Children and families who identify most in need will be served first with the available funding. We encourage families to apply each year as the needs in the community change, and so some families may be allocated funding one year, but perhaps not the next. Service Coordination Support acknowledges that the funding allocation is simply not sufficient to support the growing number of applicants each year. If you are not registered with Service Coordination Support for people with developmental disabilities, we require that you submit a psychological assessment report confirming a diagnosis of autism spectrum disorder according to the DSM-5 to be determined eligible for ASD funding. Please call intake at 613-748-1788. Please ensure that you complete all sections of the application form and check off the boxes that reflect your child's support needs or the challenges you experience. Frequency refers to how often your child needs support or how often they experience this challenge. If one does not apply to your situation, please check the Not Applicable box. To begin, please ensure to check off the box confirming that your child has been diagnosed with ASD. Next, under Child's Information, you'll need to provide your child's name, gender, date of birth, and address. Similarly, under Family Caregiver, you will need to provide your name, address, if your address is different from the child requiring support, and specify your relationship to the child. Need communication. In this following section, you'll need to identify the level of support your child requires to communicate their wants and needs by checking off the appropriate box. The first option implies that your child can clearly communicate using full sentences or fluently express themselves using sign language. The second option indicates that your child has limited verbal communication and/or poor nonverbal communication skills. They have difficulty making their thoughts, feelings, and needs known. Lastly, the third checkbox states that your child is nonverbal. Need safety. Moving along to the section below, you'll need to identify your child's level of safety awareness by checking the appropriate box. If you check off one of the boxes, you'll need to indicate the frequency of that incidence and/or behavior on the right of each example. For reference throughout the rest of the application, you can keep in mind that hourly happens several times a day or more frequently. Daily happens once or more a day, but not hourly. Weekly happens at least once a week, but not daily. Monthly happens at least once a month, but not weekly. You would check off the first box if your child lacks an age-appropriate sense of danger and does not fully comprehend the consequences of their actions. A few examples could include touching hot surfaces, climbing on furniture, putting objects in their mouth, ingesting toxic materials, talking to strangers, street safety, etc. Next, you would check off that your child is at risk of elopement if they have a tendency to wander or run away from home, school, or when out in the community. Need: self-injury. Some children may harm themselves when attempting to communicate, expressing pain or discomfort, expressing fear or anxiety, just to name a few. In this section, you will indicate if your child manifests any self-injurious behaviors such as headbanging, hair pulling, hitting, biting, pinching, scratching, and excessive skin rubbing. Need: hyperactivity. In this section, you'll need to identify if your child is in constant motion and manifests symptoms of hyperactivity, such as running, pacing, spinning, rocking, jumping, fidgeting, difficulty sitting down, and/or inability to stay on task. Need: aggression. This section gives you the opportunity to identify any aggressive behaviors that your child might manifest towards property or people. The first example suggests that your child destroys property by punching walls, breaking items, and throwing things, etc. The second example is relevant if your child hurts others by hitting, punching, kicking, biting, scratching, pinching, pulling hair, etc. Tick off the appropriate box. Need: tantrums. Some children may show intense reactions, described as temper tantrums, meltdowns, or outbursts. They may happen at home, school, or in the community. If your child demonstrates these behaviors, please identify it by ticking off the box. Some examples of such behaviors may range from screaming, crying, and stomping, to refusing to cooperate and dropping themselves to the floor for an extended amount of time. Need: personal care. This section will allow you to identify how much assistance your child requires with their daily living needs. Please consider your child's age and developmental milestone when completing this section. For example, a 2-year-old child will always require support with bathing and toileting. When determining the areas of needs, you may ask yourself these following questions. Dressing. Does your child need assistance with dressing themselves? Does your child need help with buttons and zippers? Toileting. Is your child in diapers? Does your child need assistance or supervision when going to the bathroom? Does your child need help with wiping themselves? Feeding. Does your child need assistance to eat? Does your child need to be monitored due to risk of choking? Does your child need their food cut, mashed, or pureed? Bathing. Does your child need help with washing their hair and body? Does your child need constant supervision while in the bath or shower? Mobility. Does your child need a wheelchair or any other assistive mobility devices? Does your child have difficulty in gross motor ability? Does your child have challenges with walking? Personal hygiene. Does your child need help with brushing their teeth? Does your child need assistance with washing their hands? Does your child need help with brushing their hair? Need: medical condition, secondary diagnosis. In this section, please read carefully and identify your child's medical diagnosis by checking the appropriate box or boxes below. The diagnosis must have been confirmed by a doctor. If none apply, simply check off Not Applicable at the very bottom. Need: additional information. This section will allow you to address any other challenges that have not yet been captured. Please check off any examples that align with your child's needs and behaviors. Has sleep issues. Sleep issues implies that your child may have problems falling and/or staying asleep. It could also mean that your child may have difficulties waking up and/or staying awake. You can also consider sleep disruptions, such as sleepwalking, night terrors, and/or any psychological conditions that may affect your child's sleep. Follows a special diet. Your child may follow a special diet if they have food allergies and intolerances. Additionally, extremely narrow food preferences may also fall under this category. Demonstrates sexualized behaviors. Your child may display inappropriate sexualized behaviors, such as improper touching of others, masturbating in public, public nudity, or discussion of sexualized topics at inappropriate times. Extreme sensory issues affecting daily life. Sensory issues can encompass a wide range of stimuli. For example, your child may be oversensitive or undersensitive to certain sights, sounds, smells, tastes, or touch. Fecal smearing. There are medical problems, sensory challenges, behavioral factors, or emotional reasons why some children may smear feces. Smearing covers a variety of behaviors such as taking feces out of the toilet, defecating in the bath, taking feces out of their diaper or underwear, etc. Loud vocalizations. When happy, children with higher language abilities might script lines from movies, recite books out loud, or repeat song lyrics. In parallel, children with decreased language skills might hum, grunt, shriek, and squeal. Behaviors that are disruptive to others. Children may exhibit disruptive behaviors by refusing to follow rules or deliberately annoying others, whether at home, at school, or in the community. They may also lack respect and behave in angry, resentful, or vindictive ways towards others. This can include, but not limited to, spitting at others or using vulgar and aggressive language. Other behaviors may also involve excessive argumentativeness and other forms of defiance or resistance to authority. Day support, day activity. Please check the box that indicates your child's age at the top left of this section. Below, you will identify where your child spends the majority of their day by checking off the appropriate box. Lastly, you will need to specify if they attend full days, more than half a day, or less than half a day. Please consider the following. If your child regularly attends school each day, enter a check mark in the full day column. If your child is of preschool age and is home by choice, enter a check mark in the full day column. If your child is of preschool age and is home because you are unable to locate a preschool, nursery, or daycare program because of your child's level of support needs, enter a check mark in the less than half a day support column. If your child is homeschooled by choice, enter a check mark in the full day column. If homeschooling is a result of not being able to attend school due to a suspension, breakdown of service, or school refusal, etc., enter a check mark in the less than half a day support column. If your child is participating in virtual learning due to the COVID situation, enter a check mark in the full day or less than half a day support column depending on your child's schedule. Caregiver information. This section is in regards to the parents or caregivers and the family situation. Please check off the factors which apply to your situation. I am a single parent or caregiver. You may check off this box if you are a single parent providing care with no support from the other parent. I am a senior parent or caregiver. You may check off this box if you are 65 years or older. I provide support to other family members who require care outside of the home. You may check off this box if you are caring for elderly parents or anyone else who lives outside of your home. I am a parent or caregiver with challenges. You may check off this box if you or your spouse have any mental health conditions, developmental disabilities, physical disabilities, mobility restrictions, or medical diagnoses. I have no or limited informal supports. You may check off this box if you have a limited support network. Informal supports can include neighbors, friends, and family members who do not live in your home, such as aunts, uncles, cousins, grandparents, etc. My employment is compromised due to level of care needs. You may check off this box if your caregiving role may compete with your responsibilities at work. The hours that caregiving demands can evidently have a negative effect on your work. For example, you may have difficulty getting your work done on time, or you simply have to miss work entirely. Check the final box if you must provide support during the day to your child or children due to their or your family's medical complex needs and risks directly related to COVID, preventing your children from attending school this year. Disclaimer. In this section, using the checkbox, please certify that all of the statements in this application are true to the best of your knowledge. SCS reserves the right to withhold ASD funding if the information in this application is proven misleading or fraudulent. We hope that this instructional video was helpful in assisting you to complete this application form. If you have any questions, please call our Children's Intake at 613-748-1788 and press 0 for more information and support.